Hello everyone. I'm Dr. Richard Grant. Here are high blood pressure, why Americans are deficient in potassium and magnesium. There is one dietary change that, if applied consistently, can make a remarkable difference in reversing hypertension. Over the years in clinical practice and through the research I've seen, it comes down to one very powerful adjustment: increasing your intake of foods naturally rich in potassium and magnesium. When people search foods high in potassium and then foods high in magnesium, they often discover something fascinating. The lists are nearly identical. Nature has designed many whole foods to be dense in both of these nutrients, and the benefits extend far beyond just blood pressure regulation. Let's pause for a second. You'll notice I like weaving in some light transitions. It keeps things engaging, but the real focus here is the science and the health benefits. So, back to magnesium. Magnesium is essential to our physiology. We are talking about hundreds of biochemical reactions in the body that cannot take place without adequate magnesium. Everything from muscle contraction, energy production, nerve signaling, hormone regulation, and cardiovascular function depends on it. Unfortunately, due to modern farming practices, the soil today often contains far fewer minerals than it once did. When the soil is depleted, the plants grown in it are less nutrient-dense. Add to that the fact that many people consume highly processed foods, and you can see why magnesium deficiency is a common problem. This is where supplementation sometimes becomes necessary, though ideally, we start with whole foods first. In my personal experience, and in the feedback I hear from countless patients, magnesium supplementation has one particularly noticeable benefit: better sleep. High-quality sleep, especially REM sleep, which is restorative, is profoundly linked to health and longevity. When you consistently achieve deeper sleep cycles, blood pressure naturally drops, because your body is in a state of recovery rather than chronic stress. Now imagine the opposite: someone who sleeps poorly, maybe just a couple of hours a night. Their hormonal balance is disrupted, cortisol levels are elevated, insulin sensitivity is impaired, and their cardiovascular system is under strain. That is a recipe for high blood pressure and poor health. Magnesium helps correct part of this imbalance, making restorative sleep more achievable. While supplements are an option, remember that whole food sources remain foundational. A diet rich in fruits, vegetables, fish, and high-quality meats will naturally provide far more magnesium than the standard fast food-based diet. Compare a colorful plate of whole foods with something like a Big Mac. The nutritional gap is massive. That gap, over time, influences whether your blood pressure trends upward or stabilizes. Now let's talk about potassium. Potassium is often overlooked, yet it is one of the most effective nutrients for supporting healthy blood pressure. While it is present in the same foods that contain magnesium, potassium acts in a different mechanism within the body. Its primary role in blood pressure regulation comes through the kidneys. Interestingly, potassium can mimic some of the effects of certain blood pressure medications. For example, while a prescription drug might lower systolic blood pressure by 5 to 7 points, a result considered clinically significant research shows that adequate potassium intake can achieve a similar effect naturally. Here's how it works: the kidneys regulate blood pressure through a system involving renin. Renin triggers a cascade that produces angiotensin, a compound that narrows blood vessels and stimulates the adrenal glands to release aldosterone. Aldosterone increases sodium and water retention. In other words, when potassium is low, your body tends to constrict blood vessels and retain fluid and sodium, two key drivers of hypertension. By consuming enough potassium, you disrupt this cycle. You turn off the body's natural push toward higher blood pressure and instead allow blood vessels to relax and fluid balance to normalize. So, how much potassium do we actually need? The current expert consensus is about 4,700 milligrams per day. Yet, the reality is concerning: fewer than 2% of Americans reach this level. Most fall well below even 4,000 milligrams. Think about that. Nearly the entire population is deficient in one of the most critical nutrients for heart health. The problem becomes even greater with restrictive diets. Some people cut out entire food groups, while others practice time-restricted eating or only eat once a day. In these cases, it becomes practically impossible to reach optimal potassium levels. This is why supplementation is often a reasonable and necessary step. Personally, I've found that encouraging patients to track their food intake for even a week is eye-opening. Very few realize just how little potassium they consume. And when I recommend supplementation, the improvements are often measurable: lower blood pressure, better electrolyte balance, and improved energy. This is why I sometimes suggest supplements, in addition to emphasizing a diet of whole, unprocessed foods. A simple dietary change increasing magnesium and potassium can truly transform blood pressure outcomes. It's a natural, evidence-based approach that works with the body's systems rather than against them. And it's not complicated: eat more fruits, vegetables, fish, and lean meats. These are the very foods that provide both minerals in abundance. For those who want to dive deeper into which foods are highest in potassium, I've provided resources in the links, but the short answer is, nature already gave us the perfect toolkit. Yet, diet advice today can feel overwhelming. One person says don't drink water, another says eat only meat, someone else insists that meat causes cancer, and then the debate shifts to eggs, cholesterol, lectins in vegetables, sugar in fruit, fasting windows, and on and on. Amidst all this noise, magnesium stands out as a rare point of agreement. Nearly every expert acknowledges its value. The only real debate is which form of magnesium to take. And this matters, because not all magnesium is the same. Different forms serve different purposes. Magnesium chelate supports muscles. Magnesium citrate is well absorbed and supports the cardiovascular system. Magnesium bisglycinate helps with stomach acid regulation and digestion. Magnesium malate, one of the most bioavailable forms, is excellent for migraines and chronic pain, and naturally present in fruits. Magnesium sucrosomial supports energy, immunity, and bone health. Magnesium taurate and orotate are particularly beneficial for heart function. So, which one should you choose? That's where comprehensive products become useful. A formula that combines multiple forms of magnesium can ensure that you're covering all the bases: muscle support, arterial health, energy, sleep, and heart protection. Personally, I recommend and use products like Magnesium Breakthrough by Bioptimizers, which includes 7 distinct forms of magnesium in a single capsule. It's highly absorbable, gentle on the stomach, and backed by a full guarantee. For many people, this kind of comprehensive approach removes the guesswork. Ultimately, the science is clear: deficiencies in magnesium and potassium are widespread, yet correcting them can bring significant improvements in blood pressure, sleep quality, cardiovascular health, and overall vitality. No controversy here. Just 2 minerals, readily available in whole foods and quality supplements, that have the power to change the trajectory of your health. And remember, unlike so many confusing debates about diet seed oils, fasting protocols, sugar arguments, magnesium and potassium are universally recognized as vital. Sometimes the simplest interventions are the most powerful.